remember asking you a guy.
Scorn and defiance, slight regard, contempt, and anything that might not misbecome the mighty sender. Doth he prize you, lad?
How stupid!
Oh, wow, that is very interesting. Please tell me more.
You ready?
Blah, 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 blah. See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
Man, you are one pathetic loser.
Dr. Steve, I hope you're better at prostate screenings than you are at radio screenings, you son of a bitch.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. Wow. The traditional Chinese medicine provider. It gives me street cred with the... shit, I don't want to start this over again. Is your mic on? Your mic's not even on. Try it again. There you go. And then I turn my mic on. This is very professional. I've been doing this for 20 plus years. 19 total. And still can't get the... And Carl would say, oh, you can just redo it. You know what? Fuck off, Carl. I'm not doing it. I'm not part of your system, man. All right. Anyway, I don't know where I was. If you have a question you're embarrassed to take to your regular medical provider if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347.
Pooh hit.
We're on it. Follow us on Twitter at Weird Medicine and DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Maybe we should do this more often.
There you go.
Maybe that's what the problem is. We just get rusty.
Sounds good.
Check out Roadie.drsteve.com, the Roadie robotic tuner. They have a new one. Have you played with yours?
I have. It works really well for my guitar.
Yeah.
The mandolin, for some reason, it doesn't like tuning in the high E.
Really?
And I haven't figured it out. I mean, I'm sure it's user error. I'm sure it's user error.
You know, you can use the app to program it for different instruments. And you might be able to mess with the sensitivity on that. We should look at it.
Yeah, I would guarantee it's user. It's something I'm doing wrong. Sure.
Well, we need to get it fixed. Email the company and see what they say.
I could, yeah.
Yeah, they're great.
Yeah, but
they're
it's
very
wonderful.
responsive.
Yeah, I put brand new strings on my guitar just last weekend, and just like it was easy.
Yeah, it whines too. It does the winding.
It's
awesome. Yeah,
it was pretty cool.
So check it out. It's a robot. It'll tune your stringed instrument at roadie.drsteve.com. It's ROADIE. Check out Dr. Scott's website at simplyherbals.net. How's that going?
Going all right for now.
Yeah, you still doing it?
Doing it for now, yes.
Okay.
We've still got some stuff. So
well, there's things still
we're
pending.
negotiating.
Best CBD nasal spray on the market as far as I'm concerned.
Yep.
And then, check out patreon.com/weirdmedicine. The new studio is finally up and running. I've still got some things to do in it, but I can use it. I produced my first video for Angela Does Horror. Angela was one of the producer and co-host of Normal World that no longer exists, and but she always had this website and YouTube channel where she reviews horror movies. And so the new thing that we're doing is she had me review the Human Centipede, and from a medical standpoint.
Okay.
And my position was the Human Centipede would literally last 5 minutes once you got everybody hooked up, at least 5 minutes after the first donation from the lead person.
Okay.
Because when do you know what the Human Centipede is?
Nope.
No
clue. No.
Okay.
It's this Dabbleverse thing. It's this Dabbleverse thing.
No, it's not. It's a movie. No, it's a horror movie. And
Oh.
this guy, I haven't seen it. I have no desire to see it. But he or she, I don't know who does it, sews the mouth of one person to the anus of another person. And then they go in a big line.
Oh.
So it's the Human Centipede.
I don't know how I missed it.
Yeah, I know. So my position was this would literally last 5 minutes from the first quote-unquote donation from the first person, because as soon as they, transmit bowel contents into the mouth of the second person, what are they going to do? They're going to vomit.
Yep.
And where is it going to go? It can't. It can't go back into the into the donor, because that's kind of a one-way valve for the most part.
Yep.
So it's going to go out their nose and then into their lungs.
Yep.
So now they're going to aspirate and then they're going to die. Yep. And what happens when you die? You relax your bowels. So now the third person, it's going to happen to them. And then they're going to die, and then the fourth person, and so on and so on. It's a domino effect, and they're all going to croak. So if you want to see this video, just go to youtube.com/@weirdmedicine or youtube.com/@DrStevePresents, because I'm going to put all those kinds of videos just over there so they're not mixed up. I'll have one channel where there is not a bunch of different types of content, because on our YouTube channel right now, we've got our podcast and I've got my YouTube shorts and all this stupid stuff. And, we don't really do a video show. I mean, the people show up like the the king of the Dabbleverse, and Luke of the Blind, and Ari Jane is there. Hello, Ari Jane. We've never met, but I have heard her name multiple times. And then, okay, are you deleting things that people are saying?
I deleted one thing.
Okay.
One dummy.
Okay, that's fine. And is that you, Scott, QQ3UI?
Yeah, I don't know why that is.
Okay, all right.
Believe me, you know me well enough. I don't know how to turn anything on.
Yeah,
or
no.
anything up.
Yeah.
I just show up.
Yeah, Luke of the Blind says Human Centipede is the grossest horror movie ever conceived. Well, anyway, where was I going with this? Yes, we just do a behind-the-scenes video live stream of us recording our audio podcast. That's where all of our income comes from. That's where all the views come from. And, we never really pushed the video side. But I'm going to start doing more videos, and we'll see.
Cool.
I'm going to give it a year to grow. If it doesn't, I'm just going to sell the whole kit and caboodle. So.
Sounds good.
Because I'm 100 years old, and I say kit and caboodle. And that 23 skidoo. And Tyler, too. I think that's how hit goes.
Mm-hmm.
All right. Check us out on patreon.com/weirdmedicine. And if you want me to say fluid to your mama, cameo.com/weirdmedicine. All right. You ready?
Oh, yeah.
You got any topics today?
Of course not. Nope.
Number one thing, don't take advice from some asshole on the radio.
All right. And you were asking me about Stacy.
Yeah.
And, well, here he is.
Oh, cool.
Hey, it's your friend with the dumbass questions from time to time.
Awesome.
Just kind of curious, is it possible for a mother's breast milk to change colors according to what she eats?
Yeah, of course.
Just stupid questions that pop in my head.
It's not stupid.
Bye, family.
It's actually a good question, because the everything that we secrete comes from our bloodstream, and mucus is hyperfiltrated blood mixed with some proteins that are produced by cells in the mucous membranes. And, breast milk is derived from ultrafiltrated blood as well, but then there are specialized cells that add fat and protein and antibodies and stuff like that to it. So breast milk can be white or yellow, and every once in a while it could be blue, green, pink, or orange. And, it can be normal factors like leafy greens or carrots. So you'll get yellow-orange from beta-carotene in sweet potatoes, carrot, squash, and then colostrum, which is the early breast milk, is also yellow. And if you eat just a ton of spinach or kale or green food dyes, certain green food dyes can turn the breast milk slightly green. And, blue, again, from food dyes. Or a lower fat, mature milk that sat in the breast for a long time. It can turn kind of blue. Now, red can come from beets, but it could also be from blood from cracked nipples. And, black or brown can be from certain drugs like minocycline or old blood. Now, if you see pink or red and you haven't been eating something that might turn it pink or red, then you probably ought to see your OBGYN or your primary care provider. If it's black or dark brown, same. If there's any sort of weird digestive issues like gas or unusual stools, what the mother eats can affect the kid. So... I knew some people that the kid was colicky until the mother cut out certain foods from her diet, and then all of a sudden the kid turned around. So, all right. Questions, comments?
Great question, Stacy.
Very good. Yes, he's a pretty good feller.
Pretty good.
All right. Let's do this one. Oh, this is a good question. I like this one.
Dr. Steve?
Yes.
Hello.
Hello.
Thank you for answering my calls that I have asked before, questions rather than I have asked.
Oops. Uh-oh.
Hey, it's your friend.
No, I didn't mean to do that. Sorry. I was trying to delete that. Let's try that again.
Dr. Steve? Hello.
Yes. Hello.
Thank you for answering my calls that I have asked before, questions rather that I have asked before.
Yeah, man.
I appreciate it.
Of course.
I have a question that I believe I asked you, but I don't know if you answered.
Okay.
I was recently in ICU on a ventilator.
Oh, gosh.
And I was on there for 13 days.
Oh.
Nice.
And they were very adamant that they had to take me off the ventilator that day, because at 14 days,
or else
they would have to put in a trach.
Right.
Like, I'm guessing that's one of those voice box things.
Hmm.
Do you understand? Well, of course you understand. But why would they have to do that at 14 days?
Yes.
Isn't there stories of people who lived in ICU on a ventilator for years and came out and
Yeah, but they had a tracheostomy, though.
and didn't have a voice box, or I guess.
Yeah, it's not a voice box, so let's clear that up. Whenever you say ostomy, that means you're putting a hole in something.
Okay.
Okay.
Yep.
So a tympanostomy would be a hole put in the eardrum.
I've had two of those.
Have you?
Okay.
Terrible. To allow equilibrium of the. It's not to drain it; it's to allow pressure to equalize.
Yep.
So, a tracheostomy would be a hole placed in the trachea. And we do that for this reason: when you are first put on the ventilator, they shove this tube down into your trachea, and then. But if they put air in there and they just had a tube, the air would hit the resistance of the lung, because the lung is not inflated.
Right.
And you're trying to inflate it. Well, there's resistance to that, of course. So the air would just hit that resistance and then come right back out around the outside of the tube.
Mm-hmm.
So to prevent that, they there's a balloon at the end of that tracheostomy. I mean, it's the endotracheal tube, and the balloon inflates, allowing a perfect seal. So when you shove air down there with pressure, it opens. It goes into the lungs. It pushes air into the lungs, and they inflate rather than that air escaping around.
Like blowing up a balloon.
Right.
Yeah.
Right. Yeah, if you tried to blow up a balloon and you don't make a perfect...
if you don't close your mouth away.
If you don't close your mouth around it, the balloon's not going to blow up. Right. You're just going to blow air around it. That's a good analogy, Dr. Scott. I'll give you a bell.
Give thyself a bell.
Because you actually helped me. So the problem with it is the trachea is lined with a mucous membrane, and it has very small blood vessels, capillaries running through it, and when you inflate that balloon, the pressure pushes the blood supply away from that area. Of course it does.
Kind of mashes it, yeah.
Yeah, you push on your hand even, you can blanch it, that because you're pushing blood away from that place that you're touching. Then when you let go, you can see the blood rush back in. Well, 14 days about all the trachea can take of that, because after 14 days, you can kill the mucous membrane. You kill the mucous membrane, you end up with a hole in your trachea. Right. Now, that 14 days is not an absolute. I have seen people, yes, go much longer than that refused a trachea, but they couldn't take them off the ventilator.
Okay.
And I've seen people go 21 days. I saw somebody go up to 28 days, and they did okay. But you can't count on that. You don't know if there's no blood test. You can say, well, this person could have a endotracheal tube for 2 weeks. This one could only handle it for 10 days, but this one could go 3 months. There's just no way to know.
Okay.
So to prevent that, they found that 14 days will mostly prevent that tracheal damage.
Gotcha.
And the tracheostomy is just a hole and in the trachea, and they put a tube in there, and then you breathe through that. Okay. And that can stay in forever. Mm-hmm. And I've had some people, they just take the device out, and they've just got a hole there, and that's what they breathe. I've seen people smoke through that.
Yes.
That's how degenerate smoking can be. And but it is because there's no resistance to flow, you can't talk very well through that, because when you start, the way that you talk is the vocal cords close and you breathe against that resistance, and that resistance causes them to vibrate. And that noise is then modified by the upper airway into intelligible speech with your tongue, the size of your, the oral cavity. You can change the quality of the sound, all that stuff that we do naturally when we talk. The vocal cords really just make different buzzing sounds, and that are then modified. So when you have that tracheostomy in there, there's no resistance to flow anymore, so the voice box doesn't work right. So a lot of those people, even if they haven't had their voice box, the vocal cords removed, have difficulty speaking, so they have to get a speaking valve that allows them to close that thing, so that now they can push the air through the vocal cords rather than out the hole in their neck. So that's what that's about. Excellent question. It comes up in the hospital all the time.
Oh, yeah, absolutely. Yep.
So what you're trying to do is prevent a catastrophic failure of the vocal cord. I'm sorry, of the trachea.
Because, if that thing goes kind of into... without blood flow, you can cause a whole.
You just got a hole in it, and we want to put a hole in there under controlled circumstances, not just because of a catastrophic failure. All right, okie dokie. All right, that's a good one. Here's one for you, Dr. Scott. And I have some suggestions.
Hey, Dr. Steve.
Hey,
I'm a 39-year-old male.
Yep.
A few years ago, around age 35, I discovered that I have hypermobile spectrum disorder, which, of course, I've had my whole life but didn't realize. For 13 years, I've been an avid weightlifter, and nowadays it's not working out so well because I have hypermobility. I always have about 5 different injuries at once. Right now, I have plantar fasciitis, bicep tendonitis, golfer's elbow, radial nerve impingement, and some pain in my right hip as well. And I was wondering, I don't want to give up weightlifting. I don't know if I could.
Yeah.
But I was wondering if you had any advice on what I should do in my life to change this so I'm not always just riddled with pain every day. And I would also like to know if you have any advice on how I should go about the healthcare industry, because every time I go to a doctor, they're always hyper-focused on one injury at a time. So like a shoulder doctor would be hyper-focused on the bicep tendonitis, whereas no one really knows how to treat hypermobility spectrum disorder in general, so that I can be relatively pain-free.
Right, you got to look at the whole patient. I agree.
Everyday basis.
This is part of the problem.
If you have any advice, man, I'd really appreciate it, and I'm glad the show's still going because I'm a new listener from the Dabbleverse.
Hey,
so
okay, thanks, man.
Keeping it going. The show's great. Bye.
Hey, thanks.
Yeah.
So let me just define hypermobility spectrum disorder for a second. It's a connective tissue disorder. It used to be called hypermobility type 3 or hypermobility Ehlers-Danlos syndrome. And it's a genetic disorder. And these people are extremely double jointed and have elastic tissue and stuff like that. So let me just throw out a story. There's a movie. Have you ever seen My Dinner with Andre? It's 2 hours of Wallace Shawn and this guy Andre, who was a director, eating dinner for 2 hours.
Okay.
And they just talk.
Okay.
But at one point, Andre talks about when his mom was dying in the hospital. And she's dying. She'd fallen and broken her wrist, but she was in the hospital, dying.
Okay.
I can't remember if it was cancer or whatever it was. But she was soon, to be leaving this world. And he talked about how the orthopedist who had fixed her wrist went in and looked at her and came out and said to Andre, "She's doing great.
Right.
She's doing great."
Right.
And he was like, all he looked at was her wrist. He didn't look at this woman who's laying in a bed literally dying. And so that's what this guy's talking about.
Agreed.
So, and he's got a bunch of stuff going on. He wants a generalized approach to this, a quote-unquote holistic approach. I'm not talking about necessarily holistic medicine, although
of course.
Dr. Scott practices a form of that. But, you need to look at the whole person. So anyway, Scott, talk a little bit about, from the sports aspect. He wants to continue. to lift. I know there are machines that will kind of constrain the joints so that you can do different exercises and stuff. I have a suggestion for them, but go. You take it first, and then we'll talk.
Yeah, I was kind of going along the same line as you. The first thing is with hypermobile issues, joints. What we like to do is remind folks that when you have pain, tendonitis in these joints, it's from repetitive motion.
Yeah,
and a lot of times it's from overuse and over rotational stuff.
Right.
What I would say is identify a specific muscle you want to work out, and then focus on that muscle by not taking it through a too far of a range. So to be specific, like bicep curls. If you want to do bicep curls, you don't need to do standing bicep curls where you're letting your arms fly through space.
Correct.
And you're letting you're rotating your wrist and tweaking your elbows and giving yourself tendonitis like you said he had in his elbow. I would sit and I would put my elbow on the inside of my knee and I would drop that weight in a really slow control fashion straight down and just isolate the bicep and only go to the end range and not past. In other words, don't let any motion, if you're doing bench presses, if you're doing any kind of exercises, squats, don't go past what would be considered a normal end range, number one. Number two, cut down on the doing 3 sets of
the ballistic
10 kind of stuff.
Well,
first of all,
yeah.
So in other words, doing multiple rounds. I love what I call the 30-second bicep curl or the 30-second bench press. Take a really light weight and count 10 seconds down to we're doing the bench press, okay, we're laying on the bench, 10 seconds down to your chest, hold it for 10 seconds, and then back up for 10 seconds. So that's a 30-second bench press.
Okay. It's like square breathing, except.
Exactly. Very similar. Instead of taking a 400-pound and going, bouncing it off your chest and pushing it back up.
The ballistic stuff is not good for him.
Because what he really wants to do is continue to have strength. He wants to continue to have, range of motion and less pain. And you can do these things, but you want to stabilize. You want to strengthen some of the smaller stabilizing muscles that will help in this whole thing. Okay, so do that. The other thing I would encourage is Pilates.
That was one of them.
Oh, was it? Okay. I'm sorry.
No. Go ahead.
Yeah, but I think Pilates is a great way to continue to work out, exercise, maintain strength. And in a really controlled fashion.
Yeah.
So that's the thing. Don't do stuff that's going to let your free kind of flowing, twisting motions, heavy loads,
right?
Or 100 reps,
right?
Slow, controlled.
Do you know where they have these machines though? Is at physical therapy. So he could find a physical therapist. His insurance will pay for it. Go ahead.
Well, I was going to say if this physical therapist is paying attention,
right,
and is not just doing an eval and then passing them off and saying, here's a sheet of exercises.
No.
Ride a bicycle.
My physical therapist never did that. I had to go in and do these exercises. They had 1 million machines where they could isolate all these different muscle groups and stuff. That's what you want to find.
That's what you want. And they are out there. They are out there. Wonderful ones. But there are also ones out there that just are numbers, just like any other profession. We'll go in, they'll let you start. They'll say, well, go ahead and do those strengthening. No, you need somebody that really understands hypermobile disorders and how to identify these small stabilizing muscles that can help stabilize these joints.
And you can call them and ask them and say I would like to speak to one of the therapists. This is what I've got.
And sometimes you can find a physical therapist that's got your disease.
Yeah, right.
Which, like, if you got
maybe
scoliosis,
that's why they went into it.
Right. If you've got scoliosis, maybe you got somebody that's got scoliosis, and they can say, "Hey, this is what I do, and it helps."
Yeah,
so, I would ask that.
And I want to emphasize that hypermobility spectrum disorder is a spectrum. It is not the same thing as Ehlers-Danlos syndrome, and that's a kind of edge. That's why they renamed it.
Right.
So.
But anyway, keep exercising.
Yeah. And what about going to a DOM?
Yeah, acupuncture for sure for tendonitis, overuse syndromes, it works exceptionally well. I think acupuncture, physical therapy, and certainly osteopathic, an osteopathic approach sometimes to make sure that if you do have bones that are slightly out of place, that we get them back to where they're supposed to be to allow a shoulder maybe to move more freely, because if it's out of place because you have a lack of tension in these joints, then it just makes everything worse.
Yeah.
So a holistic approach.
There are some benefits to this. by the way.
Oh, are they really?
Yeah, well, there can be.
Okay.
It depends on where you are on the spectrum, but people who are hypermobile but functional may be faster runners. And some people have posited that Michael Phelps might have some hypermobility.
I could see that in his shoulders.
Yeah,
the way his
because of
shoulders move. Oh
yeah.
yeah, man.
Mhm.
He has really flexible shoulders for such
And
a strong dude.
They naturally have a larger cerebellum than average, and the cerebellum is the thing that stores the mental map and processes movement and stuff. And without training, people with hypermobility can sometimes be awkward, but when they do train, they can become super coordinated. So
now, can I add to that too? Now that you mentioned the athletes, that reminds me of a pitcher for the Pirates back in the 80s and 90s. Maybe Kent Tekulve was a sidearm pitcher, and you can see images of him, and it was like when his elbow was in front of his body, his hand was behind his hip.
Really?
I mean, it was like, how in the world does that even work? But it was kind of a whiplash thing. So maybe he had a touch of that. Yeah.
And someday, if someone's deficits outweigh the benefits, because there are cognitive benefits too. People with hypermobility disorder tend to be have higher IQs than people who don't, which is kind of interesting. Now, that's an aggregate.
Yeah, sure. That's wild.
But if your deficit outweighs the benefit, then in the future we may have a genetic fix for this, because they're working on editing people's genomes.
Yeah.
There's some real philosophical and moral and ethical issues about changing someone's DNA, but when it comes to something like this, or if you were at risk for Huntington's syndrome, I think most people would want to have their genes edited so they didn't have to worry about it.
Yep.
So
yeah, I would think so.
That's a whole other story, though. All right,
well, hang in there, buddy, and thanks for being a new friend.
Yes, and I need to send text to everybody that's sent in. I used to do that always, and I've gotten kind of behind, so I haven't been doing
busy,
it, but
though.
I do need to do that.
Yeah, hey, Dr. Steve.
Yes.
Could you talk about this thing called VABBING? I really don't get it, at all.
Okay.
Thanks.
Do you know what vabbing is?
No, never heard of it.
Okay.
Of course, I hadn't heard of a centipede movie.
Oh, yeah, okay, fair. It's vaginal dabbing, and what women do is, well, not all women, but some women, take their finger and shove it in their vagina and then use it as cologne. And they'll put it on their pulse points like necks and wrists like perfume. And they think it's a pheromone-based scent to attract romantic partners. Now,
say that again. They
take vaginal fluid and then they dab it, behind their ears and on their wrists and stuff like perfume.
Gotcha.
Thinking that somehow that's going to attach. Right, attract. And
interesting.
Yeah, there may be a placebo effect to this, that the person who does this feels more confident because they did it. It's like some people who have performance anxiety, men who have performance anxiety when it comes to erectile dysfunction. They don't have anything physiologic wrong with them, but they just get scared and then they can't perform. But they put a Viagra in their wallet and all of a sudden they're fine because they know they've got that secret weapon in their back pocket.
Yeah. Right on.
This was popularized by TikTok in 2022, and there was this influencer that started this. And dermatologists say, obviously, endocrinologists as well say there's no scientific evidence to support that this does anything. But what if you had herpes or HPV and then someone's nuzzling around on your neck because you got, could there be transmission? I do not know that there's ever been any single case ever reported where this happened, but there you go. But I think it's the placebo effect. But it's
interesting.
Women, please stop doing that. And I saw an Instagram post talking about this, and it just said TMI, and they just meant too much internet. That's pretty funny.
It is true. Oh wow,
Right.
that's
A
crazy.
good one. All right.
Yeah, hey, Dr. Steve.
Yes.
Got a question here. I don't really, I don't know how to say it other than,
Just say it.
why is it that you really got to take a poo after you drink coffee or that espresso stuff? Hey, thanks.
Yeah. Okay. Well, coffee acts just as a natural stimulant. It's for the most part the caffeine, because when you do decaffeinated coffee, it's not as predominant of an effect. But even decaf can do it. So there's other things in coffee. Like, for example, I can drink tea. It's got caffeine in it. I can drink 5-hour energy. It's got caffeine in it. But I can't drink coffee. Mm-hmm. So there's something else in there. But coffee itself triggers the release of a hormone called gastrin and another one called cholecystokinin, which cholecystokinin causes the gallbladder to contract.
Right.
And this all speeds up digestion. And, the heat of the liquid, you've talked about that before, too, that speeds up.
And the time of the morning, people usually drink coffee. It's about the time of the morning when you normally go
It may just be that.
A lot of those things together, yeah.
So now, so it's not universal, though. Not everybody has that. Obviously, this caller, who sounds like I'm sure she lives in Alaska somewhere, is obviously affected by it, but not everybody.
Right on.
All right. Now, let's just say you're lactose intolerant and you don't know it, and you put milk in your coffee. That could do it, too.
That'll do it for sure, yeah.
So it may just be that.
Yep.
So anyway. All right. Well, let's get out of here for this week. Don't forget Dr. Scott's website at simplyherbals.net. It's still going, so check that out. We're no longer selling DabbleDice on the main store at dabblegames.myshopify.com, but somehow people are still ordering it. I don't know how. There's some channel somewhere, some button somewhere where people can order it, and feel free. If you order one, of course I will send it out, and I send you an autographed card that shows you how to play Deuces Wild in the casino. I can't sell those because when I tried to do that, Google shut me down. So, but it'll show you how to play correct strategy on the one game in the casino that has a positive expected value for the player. And then I throw, some other stuff in there. Sometimes it's a holographic weird medicine sticker. Just who knows? But anyway, if you can find it, you go right ahead. I've still got 2 boxes of the effing thing, so I'll be giving away these at Hackamania to VIP listeners, and I'm sure people can win them or whatever. So, or just come and see me. I'll give you one. All right. Well, thanks always go to Dr. Scott. Thanks to everyone who's made this show happen over the years. And until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get us some exercise. We'll see you in 1 week for the next edition of Weird Medicine. All right. We have enough calls. You want to do another one?
Yeah, man.
Yeah?
Yeah, yes.
Okay.
Yeah, hey, Dr. Steve, could you talk about this thing called VABBING?
Never heard tell of such.
I really don't get it,
I ain't never heard
like, at all.
of such. She needs to call back more often.
Yes, we like that. We like that.
I expect she's from Round Char.
I reckon so.
All right, let's see. Hypermobile disorder we did. Yeah, okay.
Yeah.
Right.
Yeah, and I just sent you that email.
Yeah, we've got what do they do with body parts, philosophy of teleportation, a bunch of stuff.
Ooh, teleportation. Yeah, let's do that.
I can't find. Where in the shit? All right, well.
Hey, McRibs is on.
I can't see the screen. I don't know where it went.
Oh.
Let me get back in. There we are. Okay, now I'm back. Well, we will jam. Did you work on that song by the way?
I did not know.
Okay,
but I did listen to it. It's just a. I do.
It's
I want
just
to.
two chords, and I can play the piano.
Yeah,
on
it's two chords easy. It's just the depends on how close you want me to be to the
it's your
timing.
Yeah. No, I don't care about that.
Okay, yeah.
Oh, wait, and you've got questions in the chat room too. All right, you ready?
Yeah.
Okay. I wish they'd just stop changing every friggin' thing.
Yes.
Just leave it alone. It was fine. Okay. All right. Here we go.
Scorn and defiance, slight regard, contempt, and anything that might not misbecome the mighty sender, doth he prize you at?
Blah, 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 blah. See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
You get nothing. You lose. Good day, sir.
Dr. Steve, I hope you're better at prostate screenings than you are at radio screenings, you son of a bitch.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred with wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And if you want to check out the Rhodey robotic tumor, I don't want a robotic tumor.
No.
The Rhodey robotic tuner. Go to Rhodey.drsteve.com, or you can just go to stuff.drsteve.com. stuff.drsteve.com and scroll down. And it's incredible. You just attach it to the key, click the string, and it goes whoop, whoop. And what it really is useful for, in my opinion, is restringing your instrument, because that is a pain in the ass.
It is.
And it will do it for you, and it will tune it up, too.
So much quicker.
So, anyway, check that out. Simplyherbals.net, I already mentioned. Dr. Scott still has the greatest CBD nasal sprays. Got a little bit left, so check him out. And he'll throw in a tchotchke or two as well.
Yeah, absolutely.
And doing some interesting things at patreon.com/weirdmedicine. The studio is finally up. I'm making videos. I'm trying to make at least one explainer video a week. So we'll see how that goes. I'm going to try to grow it over there. And if you want me to say fluid to your mama, cameo.com/weirdmedicine. All right, very good. You got anything, Dr. Scott?
Nope.
Of course not. Why do I ask? All right.
Show prep is not my thing.
Hello. I have a question. I'm one of those douchebags.
No, you're not. Here.
Number one thing, don't take advice from some asshole on the radio.
Now, my shrink used to fuss at me. Oh, why are you saying so many negative things about yourself? It's like, because I'm an asshole.
That listens to trials, and they're talking about cardiac tamponade. And apparently that's when fluid fills the sac around the heart.
Correct.
And the heart can no longer expand and contract because of the fluid, the pressure from the fluid. So you die.
Well, fluid is non-compressible. Water is non-compressible. So when you have the sac around the heart that kind of protects the heart, and it's part of our embryonic development, if it gets filled up with fluid, then the heart can't expand, and it can still contract, but it can't expand. If it can't expand, it can't, quote unquote, suck in blood from the lungs, from the pulmonary vein, and therefore it doesn't have anything to pump out.
Right.
So that's the problem, and you get short of breath. And
to be clear, the sac around the heart is pericardium is even though it's flexible, it's really rigid to keep the heart in that shape.
It can't balloon out infinitely.
Right.
Just like the sheath in your
brain,
or your something people are more familiar with, around the shaft of the penis. It will expand up to a certain point, and then it won't anymore, because if it just continued to expand, you just have a giant balloon down there.
It'd be weird.
Yeah, it'd be weird. Okay, all right, anyway. All right, so let me run this back a little bit.
That listens to trials, and they're talking about cardiac tamponade.
Yeah.
And apparently that's when fluid fills the sac around the heart.
Yes.
And the heart can no longer expand and contract because of the fluid, the pressure from the fluid. So you die. But if you have a leaky aortic valve or something like that, why doesn't that sac fill up? So I know somebody that has a leaky valve and needs replacement.
Yes.
But they're looking at February for a valve replacement.
Right.
How come that sac around the heart isn't going to fill up before then?
That's such a great question. When they say a leaky valve, so let's say you have a leaky aortic valve. The aortic valve allows blood to be pumped out of the heart, but the back pressure does not allow the blood to go back into the heart, because if there was just a tube there, when the heart contracted, blood would go out, and then when the heart relaxed, the blood would come back in again, and then you would get nowhere.
Right.
So there's a valve there that allows blood. It's like a diode. It allows blood to flow in one direction, because when you're pumping, it opens, and then when when the heart is relaxing, it closes. So the blood can only go forward.
Right.
Okay? So now a leaky valve is one that allows some of that blood to come back into the heart, so that the efficiency of that pumping is decreased. Okay?
Yep.
So, and that's it. It's not leaking into that sac. The sac is separate from the blood flow completely. It has its own blood supply, but it is not connected to the blood flow from the aorta. The only thing that are the blood vessels that are attached to the aorta that deliver blood to the tissues. Okay, so the aorta comes out of the heart. The carotid arteries branch off of that, so that goes up to the brain, and then the blood keeps, the aorta keeps going down, and then it starts feeding things, and it down around the lower abdomen, it splits into two arteries, the iliac arteries, that then split again, become the femoral arteries, and et cetera, et cetera. It's all kinds of, and along the way, it's feeding the superior mesenteric artery, which gets the intestines, and then the inferior mesenteric artery, and then the renal, it just feeds everything.
Right.
It's incredible. So if that sac was hooked up to that, it would be a really bad design flaw.
Yeah.
So, all right. So that's an excellent question.
He's going to pass away.
No. Unlikely. What they want is they've scheduled this so that it's not an emergency surgery, because when you do emergency heart surgery, the odds that something bad's going to happen increases. So they're scheduling it out. They're making sure they've got all their ducks in a row. They're saying this is not an emergency. It's leaky. It needs to be fixed, but he'll be okay until then. So what you're worried about, and it's awesome that you're worried about your friend, is if this was leaking into and causing pericardial tamponade, then why are they waiting so long? So I understand the question, but that's not how it works.
No.
Now, if he did have pericardial tamponade, they would go in and do a pericardial window. It's where they open up the chest, and then they take out a patch, maybe a circular or rectangular patch of the pericardium, allow it to whatever's causing it. It's usually inflammation of the inside of the pericardium, for that fluid to flow out into the body, and then the body just deal with it.
Absorbs it up,
Yeah, the heart can continue to beat normally.
Yep.
All right.
I guess I have another question.
Okay.
When I was in ICU, I had a heart attack. I was in ICU.
Oh,
the intensivist told me that the heart doctors, cardiologists, really don't care about the right side of the heart. They only care about the left side, and intensivists care about the right side.
That's
what
kind
the
of
fuck
true.
does that even mean?
That is,
and why?
That's really interesting. That is kind of true, but it's not totally true. But what we're talking about is left heart failure versus right heart failure. So the right side of the heart takes blood from the body. The veins all collect, and then it is dumped into the venous blood is dumped into the right side of the heart. Now, the right side of the heart is low pressure. All it has to do is take blood into the right atrium, pump it down to the right ventricle, and then from there it pumps into the lungs through what we call the pulmonary artery. And an artery is any vein going away. It's not whether it's got red blood or blue blood, right? It's going away from the heart or coming toward the heart.
Right.
All things coming toward the heart are veins. Everything going away from the heart is an artery. Right. So the pulmonary artery has deoxygenated blood, and it is pumped into the lungs to pick up oxygen. And then it gets pumped back through the pulmonary vein to the heart. Now, that right side that does the deoxygenated blood is the wall is thin, and it's very low pressure. And you can get right heart failure, but the right side is resilient to lack of oxygen because it deals with deoxygenated blood. It's very adaptable. And, right heart failure causes uncomfortable symptoms like swelling of the legs. That makes sense, right? Because you're trying to pump blood up to the right heart, but if it's over primed, it's backing up. Where's it going to back up into? Everything below it that's trying to feed it fluid. So, and the terminal part of that is the legs. So you get big, giant legs. You can get fatigue, obviously, because you're not pumping as much blood to be oxygenated, etc. But it's less likely to cause that sort of severe breathing failure compared to left-sided heart failure. Left-sided heart failure is a real problem because that's a muscular ventricle. The left ventricle is pumping all the blood to everywhere in the body, including the brain and even the heart and everywhere. So if it's decreased efficiency because it's not beating hard enough, and it's like a pump that's overprimed, where's it backing up into? It's backing up into the lungs because that's where the fluid coming into the left ventricle is coming from. Well, when you back it up into the lungs, now you've got fluid in your lungs. It becomes a vicious cycle. You can't get as much oxygen into your bloodstream. And so there's decreased efficiency of the heart because it relies on that same blood supply. And, now you're backing up even more and you get this, exacerbation of congestive heart failure or acute congestive heart failure. And you'll see symptoms like pink frothy sputum, shortness of breath, chest pain. When you look at the x-ray, you can see that it's cloudy in there with all the fluid kind of puffing up all the tissues around there. So it sucks.
Yeah.
So that's why. So, yeah, the intensivists do deal with right heart failure, and the cardiologists are all about congestive heart failure, but they do both.
Sure.
There's no intensivist that would ignore left heart failure, nor is there any cardiologist that would ignore right heart failure. They call it diastolic dysfunction, and it's a whole other thing. So,
hey, and I've got a quick question for the fluid family going along with this whole theme. MSIP747. If you've had a heart attack before, will the second heart attack always be worse than the first heart attack?
Not necessarily.
Yeah.
You can have a big heart attack and then just ding, a little vessel, and it could be
technically a heart attack, but
technically a heart attack. It could be what they call a non-NSTEMI, non-ST elevation myocardial infarction. Now,
it's all about what gets blocked off.
The paradigm back in the day was if you had what we would call an incomplete heart attack in the 80s. That puts you at risk for having another big ass heart attack.
Okay,
because
that's where the saying came from. If the first one doesn't get you, the second one will.
Right,
or
that's right.
Okay,
that's
gotcha.
right.
So what's an incomplete heart attack?
Well, we would call that an NSTEMI now.
Okay, good.
It's there is cardiac damage, but not nearly enough to cause enough damage to where your EKG changes and all that stuff. The enzymes go up. Remember, when you kill blood cells, when you kill heart muscle cells, they have specific enzymes in them that are unique to the heart, and you can detect that in the bloodstream. So if that goes up, but the EKG doesn't change, it's not a classic heart attack, they'll call it an NSTEMI or non-ST elevation myocardial infarction. Now, if you have the full bore thing, you will get a weird current in the heart because of the damage that's being done, and you'll get changes on the EKG that we call ST elevation, and that's a STEMI. So that's the real deal. So you could have a couple of NSTEMIs, and then we have the STEMI. But now, these days, we have cardiac catheterization, and you can go in, see what the actual anatomy is, what the clogs are, and you can go in and balloon them or put stents in and all that kind of stuff. So you're probably, a lot of that stuff reduces the symptoms of angina, but it doesn't do a whole lot for survival. But now with these drug-eluting stents and all that stuff, where they put a stent in there and it actually has drug in it that will keep the vessels open, they're greatly improved. So,
absolutely.
All right. So that's what that's coming from. I think that's probably where that idea is coming from. So, all right.
Yeah, it's a great question there.
All right. That is an excellent question. Let's do. You got any more from the fluid family while I'm doing this?
No, but evidently Cardiff has huge calves.
Cardiff.
Yep.
I have huge calves for someone my size.
Whatever that means.
That just means you're in good shape.
He's got good oxygen flow to his calves.
Cardiff is in there?
Yeah, evidently. Yep.
Oh, yeah. Hello, my friend. All right.
How funny. And we did get a Galaga 777.
Oh, yeah.
37, yeah.
That's gone.
20 Weird Medicine gift memberships.
What?
Yep.
Wow. We need.
So thank you.
We need one of those things like when they do it on TSN, they do like this. I don't know what like they're taking certain body parts in their mouth, and then other ones have something. What should we have? Maybe this one.
He's a fucking idiot.
Or
well, that's because you're an idiot.
You get nothing. You lose. Good day, sir.
That's probably. appropriate for buying 20 Weird Medicine membership. But thank you. Galaga. Yes. All right. Oh, T.O. Hank is in there. T.O. Hank is fun. We were in Las Vegas together, and they were playing this bubble craps thing. And it's like, can we just play real craps? But T.O.'s sort of the godfather of all the people out there. You know, he's taking care of everybody. Hello, T.O. Hank. And Tuxedo Crank says, I had a quad bypass that didn't take. Had to get 5 stents. Am I a failure? No. But listen, people, I give a talk about compassionate communication, and I say, listen, patients don't fail anything, because they'll say, well, this patient failed chemotherapy. They didn't fail anything. The chemotherapy failed them, right? Stop saying patients failed things. It's not true. So, no, you are not a failure. You've just got really bad disease. All right. Uh-oh, what happened there? Oh, boy. You know, I don't know.
I've got another quick question.
Yep,
it's
go.
a quickie.
Good.
Joe 479 wants to know our thoughts about vibration plates.
Well, what the hell is a vibration plate?
So vibration plate is a thing that you can either stand on, lay on.
It's good for neuropathy.
It's good. That's what I was going to say. So or if you're seated in a wheelchair, you can just put your feet on them, and it'll shake your feet, vibrate
so
your feet.
So the question is,
what are you using it for? What are you going for?
What are you trying to accomplish? People say, is vitamin D good? Well, what do you want to accomplish? You want to prevent rickets? Fucking great. It's a drug of choice. But do you want to prevent cancer? Well, we don't have any really good data for that. So, yeah, so vibration plate, great for neuropathic pain. What else can you think of? It might be, if it vibrates enough.
Lymphedema. Lymphedema certainly
could be.
Potentially, yeah.
Could be good for, to increase blood flow.
Sure. Yeah.
Vascular insufficiency. Actually could be good for some people with low back pain if it's kind of vibrating, getting things back where they're supposed to be.
Especially if your fascia is stuck and it needs to be moved and it hurts to move.
Yep.
Sometimes a little vibration can help.
Mary Jane says that they have one.
Yep. I got no problem with them. I mean, I'm not saying they're going to cure anything, but they're not going to hurt anything for sure.
Yeah.
And they might be beneficial for some of those things.
I was on Be Dabbling Live last week. And it kind of turned into a mini Weird Medicine episode, which pissed a lot of people off, I think. But, it's just, what else am I going to talk about? But Mike Coots, 74, said, Dr. Steve, I love you. Thank you for my buy one, get 3 free DabbleDice. So I don't know what happened, but he called in. And he said, yeah, I ordered one, and I've got one, and now I've got another one, then I got another one, and I got all these autographed cards and all this stuff. He's like, Steve, you can stop sending me DabbleDice. I just print out the thermal things, whatever the Shopify app tells me to do, and I get, I pack them. I use a thermal printer, slap them on there, and send them out. So I have no idea what the hell happened there. It was funny.
Hilarious. You can't have enough of those DabbleDices.
Nope.
That's for sure.
Yay. All right. Yeah, okay. So Chris Mack, Ari Jane, and Tuxedo Crank walked into a bar, and the bartender said, y'all get the hell out of here. There you go. Thank you. All right. Anything else from the Fluid family?
No, sir.
And thank you, Mike, for the $5 super chat too. Not required. We were reading all the what they call the poor chats too. So, all right. Okay, let's hit this one. We did okay. Oh, this is going to get us in trouble, but we're going to do it anyway.
Hi, this is Mr.
Back in the day, GVAC loved these.
Okay.
These
no,
questions.
I know what it's about.
John Jennings, and I emailed you about asking if it's possible to have an increased risk of an uncircumcised penis contributing to a UTI or any kind of topical antibacterial thing that you might use on it that could contribute.
Yeah.
Take care. Bye.
Yeah, so, GVAC used to love this because I got into it with those intactivists at one point. And in my defense, all I was asked was, what is the American Academy of Pediatrics stance on circumcision? And I went to the AAP, found the link, and replied to the person. And apparently they're looking for that, and they just jumped into the thing and just started shit.
Oh, wow. Yeah.
And I was like, I didn't even express an opinion about it. I just answered a question. So anyway, listen, everyone should have the choice. It is a cosmetic, for the most part, procedure that the patient generally does not have consent, because parents do it anyway, but parents do all kinds of stuff without their kids' consent. They can't consent. Kids legally can only assent to things, and infants can't even do that. So it's just one of those things. So you have an argument with the people that you want to argue with, because I don't have a strong opinion about it. But uncircumcised males, scientifically, do have a higher risk of urinary tract infections, especially in infancy. There's studies showing a 10 to 12-fold increase in young uncircumcised boys due to bacterial colonization under the foreskin. Now, having said that, that is relative risk. What's the absolute risk? So we would have to, and we should do this to give you the absolute risk, because that will tell you the number needed to harm. Remember, if you have 1,000 kids who are circumcised, 1,000 kids who are uncircumcised, and out of that 1,000, you have 0.5 kids who are circumcised who have so it'd be 1 in 2,000, right? Who have a urinary tract infection, but you have 5 in the other group. Well, that's a 10-fold increase, but the absolute risk is only 4.5.
Okay.
And that's out of 1,000. So now you have to take the inverse of that to get the number needed to harm. In other words, how many uncircumcised males, or you can get the number needed to treat, same way. How many people do you have to circumcise to prevent one urinary tract infection? Do you have a calculator with you?
Nope.
We could do that.
But I can find one.
All right, I got one. So let's just say those numbers were right. And if you would, Dr. Scott, while you're sitting over there on the computer, Google prevalence of urinary tract infection in circumcised boys and the prevalence in uncircumcised boys. We can actually calculate this. But let's just say in this case, we're saying 4.5 out of 1,000, so 4.5 divided by 1,000, and then take the inverse of that. And that would be, you would have to circumcise 222 boys to prevent 1 urinary tract infection. So is that worth it when urinary tract infections are so easily to treat? It's not a compelling argument. Did you find something?
Uncircumcised males are increased risk of genital herpes.
Uncircumcised.
Yeah, uncircumcised,
Yeah. So, there's benefits to being circumcised,
Oh, yeah.
absolutely.
Yeah.
Increased sensation during intercourse, all that stuff. Although some people say that they're more likely to have premature ejaculation because it's so sensitive. Okay, he's not finding it, but...
Well, I'm right now on the NIH, and it says, this is from 2013.
Actually, we're looking for incidence rather than prevalence, but go ahead.
Oh,
That's
sorry,
okay.
Yeah, I was just going to say, let's see, single risk factor of lack of circumcision confers with 23.3% chance of urinary tract infection during a lifetime.
Okay, that's
greatly exceeds
uncircumcised.
That's correct. Uncircumcised. It greatly exceeds the prevalence of the circumcision.
Okay, so what is it for circumcision?
1.5%.
Okay, 1.5 minus 20.
23.3%. Yeah.
Okay,
That's a pretty big difference.
233 minus, what was the other one?
1.5. Yeah.
0.015. So the absolute risk is 0.218, and take the inverse of that. That's 5. So, you would have to circumcise 5 people to prevent one heart attack. Why do I keep saying heart attack? It's because usually we talk about heart attack in this context. To prevent one UTI. We'd have to look and get rigorous numbers on that.
Sure.
So,
and I probably didn't look up exactly what you needed either, to be honest.
It's all right.
But I did my best.
Yeah, here's another one. One meta-analysis suggests 32% of uncircumcised males experience a UTI in their lifetime. A UTI, okay? We can treat UTIs.
Mm-hmm.
Compared to 9%. So people, will stretch on some of these things and go, well, but it really, is that a compelling reason to circumcise somebody? I don't think so. But again, that this is a parent's choice, and your argument is with them if you think that they shouldn't have that right to make that choice. So your argument is not with us. All right. Excellent question, though. Here's a good one.
Hello, Dr. Steve,
Uh-oh.
Dr. Scott, and whoever else is in the studio, and Fluid family.
Yep.
Quick question for you.
Yep.
Sometimes when I go to the bathroom and urinate, it looks like you poured a 40-ounce beer in there because there's so much foam. And
Okay.
sometimes there's hardly any foam when you finish urinating.
Yeah.
What's the difference?
Yeah. Okay. Do you have anything on that?
I would say just concentration, dehydration versus being hydrated.
Yeah, and protein, too.
Yeah, and protein urine. Yeah.
So occasional foam is absolutely normal, but if you have foam all the time and it's thick and it persists, and if you have any other symptoms along with it, you need to get your urine checked. They can do a urine for protein just to see if there is a thing called proteinuria.
Proteinuria.
And, it could, but like Dr. Scott said, it could be dehydration, which would concentrate the urine.
Yeah.
If you have a really forceful stream, you'll make more foam just because you're churning up stuff more.
Especially if you're really far away from the water there, Stacy.
Yeah, right, because he's 40 feet tall.
Exactly.
But diabetes, high blood pressure can cause protein in the urine, certain autoimmune diseases, and all of these things can cause kidney damage that leads to protein loss. Urinary tract infections can do it too, and just a protein-rich diet. So I noticed that certain things that I eat can cause more protein. So, all right,
all right.
That's all I got on that one, to be honest with you. I thought he was calling about head on beer, which I did have a whole treatise on. So anyway, all right, here we go.
Hello, Dr. Steve. It's
Hello.
Tom from Michigan.
Hey, Tom.
I'm calling once again to ask a question about what happens to your body parts that get removed.
Yep.
Whether it be a leg, an arm, a finger,
Yep.
a tumor, a breast, if you get a mastectomy.
Yep.
Or even if you get something as small as like a mole removed.
Yes.
And they punch out that little thing of skin. Does it all get burned in an incinerator? Does some just get thrown in a biohazard bin? Thank you, Dr.
These are people, thank you, man. These are people's body parts, and I've had people request their gallstones and have them refuse. And I don't know if the surgeon, but I do know, and that's unusual. Most of the time, they'll give you a jar of gallstones. I do know that if you have a limb removed, sometimes they will argue with you about that one if you want it. But there are people who have, religious or cultural reasons for wanting their limb back, and they can they
bury it
or cremate it or do whatever. But it's got to go to the mortuary first that way, then they'll give them back. After it's been processed and stuff, they're just going to chop your leg off and just give it to you. And I think part of it is that could be evidence in a lawsuit, I guess, maybe.
Oh, I hadn't thought about
Yeah.
that, but yeah, I could see that.
Yeah, and because if you take it off and just burn it, there's no evidence
No
left.
evidence,
I'm
yeah.
just saying, Now, every once in a while, they may ask you if you want to donate it to science so that they can preserve it and dissect it for educational or even artistic purposes. There are bodies that have been donated where they've sliced them up and put them between glass, and you can go visit those, and it has an artistic and educational purpose to it. So, usually you're asked what you want to do with the limb, if it's going to be used for research. Otherwise, they're going to hold the limb, in the hospital for a specific period of time, and then they're going to incinerate it.
Okay.
So there you go. But yeah, you should have some agency on what they do with your limb. But if you say, listen, I want you to put it on a spike out in front of the hospital just to warn other people not to come to this hospital, they're not going to do that. But the pathologist almost always will look at the limb just to make sure it's what they, that they sent them what they said they did.
What they're supposed to, yeah.
And it's another medical legal thing to say, yeah, you took a mole off and this is a mole.
Right.
Or you took a toe off, and yes, it is a toe that has gangrene and necrosis, and so that's just more medical legal stuff. If later on somebody says, yeah, they took off the wrong toe, or my toe was totally fine and they took it off. All right. That's pretty interesting.
Oh yeah, that's a good question.
Good questions. Okay, this is the one I really want to get to.
Hey there, Dr. Steve. This is your old pal, Logan Field.
Hey, man.
I've been seeing a lot of stuff here online about this new Star Trek show and everything. It looks really bad.
I don't know.
I'm probably not going to watch it. But I had a question. I was running around the other day, and I was thinking about the teleportation and process and transporters and all that. So let me get this straight. So when you get transported, my understanding is you get transported, you are broken down molecularly, you're killed, basically, and then you were.
That's one way. That's one way of doing teleportation in science fiction. But yeah, that's Star Trek.
Rebuilt on the other side, wherever you're going, right? So my question is, if a person, in fact, has a soul and they've never been through the transporter before, so the first time they go through the transporter, basically they're killed. But they aren't killed. They're copies on the other side. But their soul basically is gone because you're dead for all intents and purposes.
Okay.
And your soul goes back to the soul well or wherever you.
Well, where does that mechanism come from? Who says that that's how it works? Now that part, that's faith-based. He's making this up.
Okay.
Okay. So, and other people may feel the same way, but This isn't part of the science of this, but I'm going to talk about why teleportation, the way they do it in Star Trek, is not possible.
Want to say so? I was wondering what your thoughts were about that because it's interesting to think about, like all these soulless people walking around on Star Trek.
Yeah, that would be if it did work that way, it would be crazy. Because they'd come out and just not have any soul whatsoever, whatever that is. But we don't know what that is, so it's hard to say. But I think if your consciousness survives, then whatever eternal thing, if there is such a thing, would go with you. But leaving that aside, how would you deconstruct somebody on one side and then transmit that information somewhere else and have them recreate you? So they would have to recreate the state of every particle in your body to do it right, so that your brain goes to the other side and all of your memories and sensations and all that stuff are intact. Well, okay, so you get a scanner and it's so precise that it can read every single atom in your body. Well, great, except that electrons and subatomic particles do not exist in a defined state. The more you know their position, the less you know their momentum. And that is not because we're stupid or don't know enough. That is built into the universe, called Heisenberg uncertainty principle, is for real. If you derive the math, you can see it's inevitable. So that's the problem. We could get the position, but then we don't know the velocity. And there are other pairs of these things that when you know one very precisely, you can't know the other one. And let me see if I can look some of those up. I know one of them has to do with energy. I did do physics, but it was 50 years ago. So pairs of Heisenberg uncertainties. Let's see here. Position and momentum. energy and time. There you go. Angular position and angular momentum. You got to know all these things. And then the phase and the particle number. So the more precisely you know these things, the less you know the other things. But you have to know all of those to transmit all this information from one place to the other. Now, let's just say that we lived in a universe where you could know all those things. It does raise a bunch of interesting points because if you wanted to get rid of your girlfriend's husband, right? You just throw him in a transporter and then just don't transmit him anywhere. Now you go down for murder and you go, oh, no.
Prove it.
Yeah, no, not only that, he's in the buffer.
Mm-hmm.
There's a buffer that keeps it in a buffer. There was a Star Trek episode where Scotty was found, his ship was found, and he had tried to transport himself somewhere, but he got trapped in the buffer. So they just recreated him.
Oh, wow.
They turned the transporter back on. So you can go, no, he's not dead. Here he is. And you turn the transporter on and you recreate this guy.
Okay.
Right?
Mm-hmm.
And then as soon as your trial's over and they go, no, okay, yeah, there's no crime here, you just put him back in. Okay.
Yeah.
Or transmit him to, Alpha Centauri or something. So there's that. Now, so that kind of transporter is not going to work. A wormhole would absolutely work. And a wormhole creates a shortcut through space-time where you walk through this door and then you are in another place.
Okay.
And it's because space has folded and allowed you to walk from one place to the other. Right now, they think to create one of those, you have to have negative energy, and nobody really knows what that is, and also negative mass to hold the thing open. But if you want to read a book about that kind of teleportation, there's two of them, but Hyperion.
Mm-hmm.
Hyperion by Dan Simmons. It's a 4-book series. It's incredible. It's like Canterbury Tales in outer space, but they have these things called farcasters where you can walk through this thing, and there's this river that they have, and it's a tourist trap or a tourist attraction where you take a boat and you go through these portals, and the river goes through all these different worlds. And when you go under this arch, you're now in a different world, and it's got a different environment and stuff, and you just keep doing that. And then they shut I don't want to give you any spoilers, but it's really good. Now, there's another one, which was sort of a dimensional travel. That's like Nightcrawler and X-Men, but also The Stars, My Destination. That's how they did it. They had a way that you could learn to transport yourself without any equipment whatsoever, and you went through these sort of micro dimensions and stuff. So that would work. But anyway.
Well, fascinating.
Yep.
Hey, we got to say hi to KB 103. Finally catching a live show. Loves the show. Was wondering if you had any tips for me starting grad school. I'm going to be a nurse practitioner.
Oh, shit. KB.
Yeah.
Oh,
yeah, so KB
she
wants
is,
to be as smart as you. Yeah.
Yeah.
That's cool.
No, she's awesome.
Congratulations.
I met her a couple of times.
Oh, cool.
I think she was in Largo, but then she was in Vegas.
Gotcha.
And she's delightful.
Cool.
And I tell you what, shut up. You're already smarter than me. I just read that. Yeah. Thanks for the $4.99. Finally catching a live show.
Yes, sweet.
Listen, you're going to be fine.
Mm-hmm.
I've met you. You're very smart. And the thing is that it can be a drudge, and it depends on what school you're going to. For example, trying to find rotations can be difficult.
Mm-hmm.
So some schools have all these rotations built in. The one local to us, they have to find their own rotations.
Mm-hmm.
So if you want to email me, if they'll let you do a rotation, we can get you 1 or 2 months or even 3 months where we are. So,
pardon me.
But yeah, the advice is just do it.
Yeah, it's going to suck for couple
it doesn't
years.
even suck.
Well,
it shouldn't
it's
really
hard.
suck.
It's just, I mean, it's intense, but it's supposed to be intense.
Yeah.
It's hard.
It's master's level. I think KB probably will get her DNP eventually. She's the type that I think isn't going to want to stop at the master's level. But being an advanced practice provider, and listen, I can give you better advice after you get out. Do not take a job where you're considered a minion. And if they call you a physician extender, run. I have 25 nurse practitioners that I work with, and they are my partners. They're not my minions. We work together as a team. And I have to sign their charts. And I've got 37 years of experience, so they call me with things. And yes, I'm ultimately responsible for the things that they do. But they're my partners. So that's the main thing. The school part, you've got it. You're going to be fine.
And you'll wake up tomorrow, it will be over, and you'll be practicing.
It goes by really fast.
It goes really quickly,
But you have my email, and if you don't, I'll give it to you, drsteve202@gmail.com. You or anyone else that wants to get into this profession, why would you? You have to be called to do it because you don't do it for the money. But if you want to reach out to me anytime, I'll be more than happy to help you in any way. Okay? Yeah, that's awesome. Good for you.
Good job.
Good for you. Very excited for her.
All right.
All right. Scott looks like he has a collection of Kershaw knives. What are those? We need to look that up.
Never heard tell a sitch.
Yeah. Oh, yeah. Yeah, Tuxedo Crank says, woof, that's a lot of work. Yes, it is, but I don't know. We started this program with one physician, me, and one advanced practice provider, and now we're, at 4, soon to be 6 physicians and 25 APPs, and they're outstanding. There's not a turd in the bunch. So, but of course, I trained them all. So. All right. Yeah, KB, she says, thank you. So you're welcome. I didn't give you any advice that's worth anything, but you're absolutely welcome to call me anytime. All right. Oh, Ga is reading Hyperion. Excellent. Good for you. Let's see. McRibs, if you don't think Nikola Tesla invented all that Star Trek shit, you're fooling yourself. The man was the smartest human being to walk this planet. I just read... One of the things Tesla wanted to do was broadcast power so that you would just have an antenna and you could turn something on. And the electromagnetic fields were so strong that, people were worried about it causing cancer and stuff like that. So we transmit power through the wires. But I heard that there was a town in Europe somewhere that's now doing it, transmitting power over the, just through the air. So
wow,
that's kind of interesting. Tesla was awesome.
Yeah,
he fucked around with a bunch of cool stuff.
Yeah, he's pretty incredible.
And Tesla was in the movie The Prestige, right? Wasn't he in that? Was Tesla the one that showed them how to do the teleportation trick?
Wrong dude.
I'm okay. I'm
Give me a baseball movie.
I'm confusing some movies there, but anyway. All right, Dr.
All right,
Scott.
guys.
Well, you ready to get out of here?
Get out of here.
All right. Let me do this one real quick.
Hi, Dr. Steve. It's Tom from Michigan. I have a question about phlegm. I know different colors of phlegm, for example.
Yeah, okay. So his question, sorry to cut your call short, Tom. He's calling about different colors of phlegm. And this one I can answer quickly before the music runs out. So, a phlegm is simply mucus from the upper airway and sometimes from the lower airway if you've got pneumonia or something like that. If it's clear or white, that's normal. If it's yellow, very often you have some sort of infection, not always bacterial. Sometimes it's just white blood cells in there that are fighting a viral infection. And different enzymes can cause that color. Now, green is very often bacterial, where there's lots of white blood cells fighting. And then if it's brown or rusty color, you may have old blood in there. And then red or pink. Pink, we talked about pink frothy sputum already. Could be congestive heart failure, but red sputum is almost always blood, and that requires evaluation. Okay.
It's the phlegm.
All right.
All right, boys and girls.
All right, very good. Well, thanks, everybody. Thanks to Dr. Scott. And thanks to everyone who's made this show happen over the years. It continues to be the most fun I've had in my six decades. Oh, this is old. 7 decades of existence. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. If you want to join the Fluid family, just follow us on Twitter. Sometimes I post on there that we're going live, but the best way to do it is to go to youtube.com/@weirdmedicine. Click the like and subscribe and the notification bell, and you'll be notified when we go live. And also click the join button and just click the thing that says accept gifted memberships. GA gave out 20 gifted memberships. Thank you again. All right. And then we just kind of hang out. Go to our website at drsteve.com for schedules, podcasts, other crap. Check out Dr. Scott's website, simplyherbals.net. And if you want to see the Roadie robotic tuner, stuff.drsteve.com. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you, guys.
All right, sir.
We we did Don't Think Twice last week. It was terrible.
It
I
was?
went home I went home and put new strings on my.
Oh, because it was.
Yeah. It really did sound awful.
Really?
I thought it was awful.
Yeah, that's always awful.
At least I'm consistent.
No, I didn't mean you. I mean,
we could do souvenirs from. Souvenir from John Prine. It talks about all the snow has turned to water.
Okay.
Let me see if I can get these new strings to hold on for
Ultimate Get
a whole
Box.
song. It's going to be in G.
Okay.
See if I can get the strings on this thing to hold on for the ride.
Who said I only read the first Hyperion? It's the best one. But I'll tell you, the last 50 pages of the 4th book make all the world building and stuff in the next 3 books worth it. Uh-oh. Wait, levels were off? What are you talking about? What levels were off? It's okay. I need to know. Uh-oh.
What?
Hang on.
It was just that very last call. Just the last call.
Oh, yeah, no. But
it was muted.
Hang on. Well, that's working. Okay, I don't know. What levels were off, you guys? Oh, I can fix that. Hang on.
Oh, the snow has turned to water.
There, is that better? Tad low on the audio. No, I thought I was fixing something, but apparently I made it
Make
worse.
it worser. Make it worser.
Yeah.
Worser.
Okay, how's that? Is that okay? Okay, there we go. Okay, I won't mess with that again. That was a mistake.
What'd you do?
Oh, I turned it down. I thought I was clipping over here.
Oh. Man, I love these new earbuds.
I think that was part of the problem.
Oh, you think they were clipping?
No. I'm listening. I'm hearing differently, so I thought we were clipping. Hello. That's weird.
to water.
What's this called? Souvenirs?
Yeah, yeah. All the snow has turned to water.
Are you using that?
Come and gone.
Are you using that mic?
I'll use that, yeah. I'll use this one over here. This is Tasty's. Yeah. Turn that sucker on there. I can't, I'm glad Stacy's got some calls in today. There we go. There we go.
Okay. That's a little out of tune.
There you go. All the snow has turned to water. Christmas days have come and gone. Broken toys and faded colors. All that's left to linger on. I hate graveyards and old pawn shops, for they always bring me tears. Can't forget the way they robbed me of my childhood souvenirs. Memories can't be bought, can't be won at the carnival for free. Took me years to get those souvenirs, and I don't know how they slipped away from me. Broken hearts and dirty windows make life difficult to see. That's why last night and this morning always look the same to me. I hate reading old love letters, for they always bring me tears. Can't forget the way they robbed me of my sweetheart's souvenirs. Memories can't be bought, you can't be won at the carnival for free. Took me years to get those souvenirs, and I don't know how they slipped away from me. Go. Cold, cold wind. I tell you what, John Prine could write a song, couldn't he?
Yep. He wrote the same song over and over again, but they were all good.
I think all he did was just change capo positions, didn't he?
I know, he did more than that, but they were good, though.
He changed that capo from 1 to 2 to 3 to 4. Let's try. Let's go back to Don't Think Twice.
All right.
G is in Goofy. I think.
That's how you want to start? We usually do it in C.
Yeah, we usually do it in C. Yeah, I'm sorry. That's correct. You are right. Let's do it in C's and child A. Let's see if that sounds right. Ain't no use to sit and wonder why be. Yeah, here you go. All right, ready? 1, 2, 3, 4. Ain't no use to sit and wonder why be. You don't know by now. I ain't no use to sit and wonder why, babe. I don't hear your bass. It'll never do anyhow. When the rooster crows at the break of dawn, yeah, look out that window and I'll be gone. You're the reason that I'm traveling on. Don't think twice, it's alright. Ain't no use turning on your light, babe. That light I never knew. Ain't no use turning on that light, babe. I'm on that dark side of that road. Still wishing there's something that you would do or say. Try to make me change my mind so I might stay. Ever did too much talking anyway. Don't think twice, it's alright. Ain't no use calling out my name, gal, like you never did before. Ain't no use calling out my name, gal. I can't hear you anymore. I'm thinking as I'm wandering, walking down that road, yeah. Once loved a woman, a child I'm told. Gave her my heart, but she wanted my soul. Don't think twice, it's alright. So long, honey, baby. Where I'm bound, I can't tell. Goodbye is too good a word, babe. So I'll just say fare thee well. I ain't saying that you treated me unkind. No, you could have done better, but I really don't mind. Just kind of wasted all my precious time. Don't think twice, it's alright. Walking down that lonesome road, babe. Where I'm bound, I can't tell. Goodbye's too good a word, guy. So I'll just say fare thee well. I ain't saying that you treated me unkind. No, you could have done better, but I really don't mind. Just kind of wasted all my precious time. Don't think twice. It's all right. That was fun. What's a little bit better sounding from Fresh Strings? I didn't sound better, but the mandolin sounded better. That's the difference.
Yeah, it did sound. It was in tune.
It was in tune. And those old strings that cut off, heck, I probably hadn't had them.
I'll let you try these headphones.
I love these.
I know. Try these though.
Oh, okay, yeah. Compared to the.
Yeah. Thank you. All right. While I talk to everybody here. Yay. Let's see. Let's go back. Yes, premium, says Dr. Scott's singing is improving every week. Yeah, because he's not trying to sing anymore. He's just he's singing, not trying to sing. What do you think of direct primary care, even docs going to subscription? Oh, no, so you lost your doctor? Why, though? Why couldn't you keep them? I'm assuming they were going cash only, and it's ridiculously expensive. Yeah,
Hey.
you just got to find another one, dude. I don't know. There's around here we're not seeing that, but I wouldn't be surprised. We had a bunch of people lose their jobs, physicians.
Air conditioner, please.
Huh?
Oh yeah, please, if you don't mind, please.
Yeah.
Thank
Sorry.
you. That's okay.
Amazing. It's 2 degrees outside and still
Oh no,
hot
it's very
out
hot in here.
Yeah. They're not, but they're going to like nursing facilities and stuff. They're not really doing concierge medicine. I do concierge medicine, but I do it on the side. So I still have a regular office people can come to and have insurance and stuff. So, yeah, I don't know. It's not my favorite trend, that's for sure. Let me see. Premium 2681. Will Myrtle play the skin flute? Well, I ain't never heard of such, I'll tell you that. But I ain't much for them playing no instruments. Don't you know, my old pa used to play the stand-up bass. And he'd get on there and do the hootin' and he surely would. This needs more Dixon. Yes, I agree. And he means Pat Dixon. Let's see. All right. Well, trying all stream. I remember you shushing me when you changed it probably 4 years ago. What? Huh? Not talking to us, I think. Oh, she was talking to King of the Dabbleverse. Okay. Okay. All right. Hey.
All right.
Thanks, everybody.
Thank you, guys.
Call us if you need anything, and we'll see you next time. Appreciate you.
Appreciate you.
Thanks for hanging out with us. Oh, did I never turn the camera back on? I'm sorry. I'm an idiot. This is why we need a producer in here. I think I had it on the starting soon screen the whole time.
Oh, yeah?
Yeah. Oh, well. Did I not? Oh, you did? Oh, okay. All right. Well, then I'm doubly stupid because apparently I didn't do that. All right. Y'all be good. Thanks.